are live. Here we are with Daria, Oller. So not Daria, holler. Don't holler at her. Daria, Oller. All right. I'm going to read her bio real quick, guys. Welcome to Bono Stuff. We got La Bouche in the background. Hopefully I do not get copyright infringed. So she is a PT, DPT, athletic trainer, ATC, currently a clinical physical therapist at Proactivity in New Jersey in both an outpatient clinic and on-site with employer clients. She specializes in working with dancers, athletes, and in prevention and health promotion, which is one of my favorite areas for sure. She is also an athletic trainer and has worked in clinical research and education settings. She contracted COVID-19 in March 2020, which I noticed her talking a whole lot about on Twitter through the PT Twitter sphere. And that's where we are today. It continues to affect her daily life, including her ability to participate in and pursue her passions for dance and running. I saw you posted about the 5K. I want to ask you about that. And she is one of the founding members of Long COVID Physio, which I listened to one of their episodes, podcast. And that's not just a podcast, right? That's a whole platform.
Yep.
Yeah. And she has been sharing her lived experience on social media with all that. So we're going to jump into it. And I know you kind of wrote that, but did we miss anything major other than the 90s dance music?
Yes. 90s dance music is my favorite. No, that's it. That's me in a nutshell.
Awesome. And since we're talking 90s and we're bonding over 90s, you could do the Austin Powers joke with the, this is me in a nutshell. Help, I'm in a nutshell.
I forgot about that.
Anyway, I hope everyone who was listening continues to listen, because we have some interesting stuff to talk about. So do you want to jump right into telling us a little bit about your COVID experience over a year ago, March 2020, getting it and recovering from that, a little bit of that timeline?
Yeah. So I live in northern New Jersey and I work in New Jersey, New York City. So I was in like a hot zone for COVID. So I became symptomatic. I'm saying March 16th. That is the day I started to feel very run down and achy and just not great. And at that time, we weren't allowed to go to the doctor because in the area that I'm in, it was really bad. So you're only supposed to go to the doctor if you were dying. So I kind of self-managed, and most of the symptoms were very breathing related. My chest was very tight. I would get short of breath talking, just walking around my house, just not feeling great. And the symptoms just never went away. So the lung pain, the chest pain stayed, the shortness of breath had stayed. And I tried to start pushing back to get in. I dance and I run. So I was trying to get back to those things, thinking that I was like easing in, that was the right thing. Because as PTs, we do graded exercise. We want to push and push. And then by the time it was early July, I had been working from home. So we got back on site with some employer clients and I just crashed. I had no idea what was happening. And I didn't know about post-viral illnesses. So I didn't recognize all these red flags that were happening. And that is the long COVID. But at the time that people were just starting to recognize it and like really speak up about it. So in addition to the respiratory symptoms that I was focused on, I started to experience brain fog, just a lot of like confusion, difficulty remembering, I was meeting a lot of new people now. So putting faces and names, remembering everybody was really difficult. I cannot explain the fatigue beyond, like I've had mono's nothing compared to this kind of fatigue, and just not feeling right is the best way to explain it. Like really things were off. I developed dysautonomia. So I explain that like, I feel like I need to lie down right now. I'd rush out of the shower and just lay down because I didn't check, but I'm assuming that was my blood pressure dropping, my heart rate would go up. And just pushing through that for a few months until some lovely PTs who specialize in myalgic encephalomyelitis and chronic fatigue reached out from Twitter and said, you need to stop what you're doing, and sent me some great resources to start understanding what was going on. And then that's where I had to stop running. I kept dancing a little bit just for my own like mental well-being, but stopped running, stopped any formal exercise, tried to cut back on whatever I could to minimize physical exertion, cognitive exertion, and emotional exertion. And so that was 16 months ago. Yesterday marks 16 months since I first got sick. And the overall, like to sum it up, like my general trajectory now seems to be improving, but there's a lot of like ups and downs. Many of us feel like we're getting better, and then all of a sudden it'll crash again. It tricks you all the time. Like it makes you think you're better and you're not. So it's learning how to sort of manage symptoms, prevent things. And through Twitter, which is PT Twitter has been amazing. A lot of us PTs with long COVID have found each other internationally. So like you're saying, we have our group Long COVID Physio. We are a peer support group. So we have a Facebook group, only PTAs and PTs and some other allied health professions can join. You have to have long COVID. And then we also do a lot of education and advocacy, which we'll get into. We have all kinds of stuff that are going on to try to teach other people about how to recognize long COVID, how to help clinicians, how to help patients.
Yeah, no, thank you for sharing that. And yeah, good. Let's be grateful for this internet thing that we have access to, because who knows where we would have been, whatever, 30 years ago, or even in the 90s, and you had to dial up the AOL, and beep, whatever. I don't know if I could do the whole noise thing. As we continue to run through the 90s as a jokey part to this very serious topic.
Love the 90s.
That you remember that series? That was a great series. I love the 90s on VH1, and
I love the 80s. Yes.
That one was good too. Yes. But I do want to ask, because I got COVID this March, 2021, and I was, having followed you on Twitter, I was very worried about long COVID and returning to play too soon, and returning to things. So that was one of my biggest concerns, because you make it sound really bad. Yeah, I was a little concerned about that. So maybe help us understand the documented and best research around, what are some of those symptoms that we should look out for if you get COVID, and also, yeah, what can we do maybe to mitigate the risks of getting that?
Yeah. Oh, these are good questions. Yeah. So, like I was saying, that there were, for me and for a lot of us, there's like a shift. Like there was those acute symptoms that kind of seemed to linger, a lot of like respiratory things. And then one of the hallmark things that, not for everybody with long COVID, but it's fairly common, is what's known in chronic fatigue as post-exertional malaise, or we're saying post-exertion symptom exacerbation. So what that means is, like, you have exertion, physical, emotion, cognitive, whatever it is, and that sets off symptoms. This is not just like, oh, I kind of feel groggy. Like, you are physically ill again. Some people get fevers. For many of us, like, we literally can't get up. Like, there's points I can't speak. I can't explain how just done I am. I can't pick my head up. And that's a hallmark. So it's very different than, I'm just a little tired, I'm a little run down, or the way you'd work out and just have like DOMS or something the next day. And it can happen within 48 hours. So that's hard. It's not always immediate. So it's not always easy to recognize, I feel like this right now because I did this 2 days ago. But that's a really common one. The dysautonomia is very common too. And so that we're learning from other, like, again, from chronic fatigue and other conditions that have it, seeing really weird reactions in heart rates. There's, like, you'll see on Twitter all these, like, we joke about it, like, I forget who said it, and they're like, no Fitbit, I'm not exercising, I'm just brushing my teeth. Yeah. Or like, you literally just stand up and like, you'll see heart rate spikes. I'm in a Facebook group for endurance athletes with it, and a runner, I just saw it today. So something like, he was explaining, like, he was feeling better because he like cooked dinner and washed the dishes and didn't collapse. And it sounds like we're really like exaggerating, and that's the truth. Yeah. So those are some of the really big things, like the dysautonomia and the post-exertion symptom exacerbation. And then all the other symptoms, there's such a huge range. There's like 200 documented symptoms, and it goes like, saying the fatigue. There's a lot of body ache, muscle ache, joint pain kind of things. And when you're ruling out other possible systemic causes of that, there's the continued chest tightness, chest pain, lung pain, shortness of breath. There are people with chest pain, but all their cardiac tests are fine. So it doesn't, there are people who can have cardiac damage, but not everybody with long COVID has that. There's hair loss that's happening. I've read many posts, especially from women on that, who are literally shaving their heads because the hair loss is getting so bad. I don't know if you could hear for me, like, my voice is raspy. And I've read 2 different things on this, where one, some people seem to develop that hoarseness, like, kind of right off the bat, like it's an early symptom. Or in my case, and other people, because we literally don't have like the power coming from our diaphragm and in our lungs to project. So I end up like really straining my voice. So now there's like a rasp in it. I could go on forever with symptoms.
This is the first time I've heard your voice. So I don't know what it used to be like, but I got you there. So I guess that it takes me to the question of, well, 2 questions I have. I'm gonna make sure I come back to the first one, but the second one, which I'll ask first, because that's how I roll, is, so what do we know, and do you know what ends up being long COVID versus causing kind of short COVID? Because, like, for me, I'll just say real quick, is I had a bacterial pneumonia because I was on day 9 or 10 of testing positive, after my wife had given it to me. Thank you, wife. So, and she had like 2 days of flu-like symptoms, sinusitis type stuff, and she lost her smell and taste, but she was kind of fine. And I was feeling really good when she was sick. And then after day 9 or 10, we were, checking what we know about COVID, and that's available to us at the time. And so it said, if you're still experiencing fever and coughing, which my fever and coughing were getting a bit worse on days 9 and 10, that's when I went to urgent care, got a chest x-ray. I had a bacterial pneumonia, which is better than a viral pneumonia. So I don't know if there's something there where maybe you can tell us if you know the difference. The viral is like the COVID-y, like really bad, possibly going to the hospital, versus bacterial obviously affected me, but we were able to knock it out with 2 antibiotics. So luckily I had that version. My lungs are still affected 3 months later, but for me, and I don't want to compare apples and oranges here, but yeah, I mean, I'm just still limited, more on the high end. And again, like I'm back to, I did like a month pretty much of recovery. And then I got back to doing like CrossFit 3 times a week and mixing in some cardio. And again, I would say I was really lucky in terms of how much it affected me, but I'm worried about long-term stuff for sure.
Yeah.
But in terms of do we know how somebody develops long versus like short, if we want to call it that? No.
Yeah. There's no set thing right now.
Unlucky draw. Unluck of the
there's it literally evidence is coming out daily. There's some big things that just came out from the CDC, and World Physiotherapy just had a big briefing paper that long COVID physio help with. We're looking at all this different evidence all the time. And earlier things were showing like women were more likely to develop it. But if I remember, part of this is also like the brain fog is memory things. And I'm trying to remember all the stuff I read. But there's something this week that they were showing not as big of a gap between men and women for developing it. But one theory, when you do see if it's women more, like women are more likely to have autoimmune things. So maybe that's, like there's even theories on just men versus women, and women are more likely to push through stuff and keep going versus men, and they're like man cold kind of on the couch, which might be really beneficial. We're learning to actually rest when you're sick. Crazy. There's thoughts that it could be somebody could have already been predisposed to say have an autoimmune condition, and this was just pushed it over. I had mono and then it reactivated years later. So they're looking or things like that. There's enough of us that have had mono or something similar that might be like predisposed people, but there's no set thing right now.
Okay.
What I see with the PTs, at least, this is a very specific group of the PTs international with long COVID. We all have that same personality of like type A, go-getters, very driven. So probably most of us didn't rest enough in the beginning, especially those of us who got it in like the first wave when we didn't know anything. So that might be a predisposing factor, but there's no set thing right now.
Yeah, I would imagine there's a confirmation bias for that personality type also being the ones who are more likely to go on Twitter and be so there's definitely something there if we wanted to go down that path. But the other kind of thought that takes me to is I guess opening up the big controversial concept of, and I don't think it should be as controversial as it is, but the vaccine. So did you get the vaccine? Do we know kind of, what's going on there?
Yeah, that's been a mix too. So back in December, January, within our PC group, we're like, do we get it? What do we do? There's no evidence. It was brand new, right? There's no evidence on just people in general. So within the PT group, within long COVID physio, we've seen a mix. Like I had a normal response. The first time my arm was sore. The second time I just got a little achy. Like that was fine. But there's genuine concern. Some people have gotten a flare up of symptoms. Either what we call crashes. Either they crash from it or just symptoms seem to get exacerbated. Some people felt better. Like I actually felt really great after the first one. And I thought this is weird. And then that started getting reported. For me, it was short-lived. Right. But there doesn't seem to be any general consensus on that either. But it is a big concern where you're weighing the risk between, can I contract COVID again? What happens if I do? Right. Is it going to be worse? And then on the other end, can my body tolerate the physiologic stress of having a vaccine?
Well, I mean, if you got better, my amateur theory would be, your body was finally adapting to that kind of like reset almost, I would think. And you're kind of hitting it with that, a little bit of a hormetic response, if you will. And it was able to say, this is what we're supposed to do. And hopefully that was kind of the helper. But yeah, like you said, it was short lived and who knows, but
there's one of the theories on long COVID is, for some people, again, this isn't everybody, it could be a viral persistence, that your body just never fully cleared the virus in that acute phase. And that could be why the vaccine is having an effect on some people, but maybe not others if they're having the autoimmune response.
Interesting. Yeah. And did you, other than the mono, do you know, or did you have all the, like, there's a lot of autoimmune stuff that could be going on. Did you go through some of that more thorough testing at all, or?
And like previously, I outside of like, again, like mono minor stuff, like I'm perfectly healthy. I haven't gone through like any other testing, which actually I'll explain because this is good to know. So like I said, in the beginning, we couldn't go to the doctor. It was not good where I was living. And then I was kind of figuring out how to manage and watching what other people were doing on social media and getting told that they were fine when they clearly weren't fine. But on the other end of it, like their basic diagnostic tests were all negative. Blood work was negative for people, so unless some people do have some positive test results, a lot of people, everything was coming up fine. And I was just like, I don't want to go through that and be told that I'm crazy, that it's in my head, because that happens to women already. And now it's even worse in pandemic. And then I kind of told myself, right, in January, I'm getting insurance. I'm going to do this. And just signing up for insurance, picking a plan, just going through the prompts was so much for my brain. And my mom calling me multiple times a day, did you sign up? Did you sign up? And it was just such a difficult, which sounds silly, but such a difficult process for me just to pick a plan. And there wasn't even that many options I was picking from. When I looked at the list of primary cares and how do I find someone who knows long COVID that I'm not going to get stuck? And then there's a list, like there's websites that have lists of the long COVID clinics. They all have like giant waiting lists now. So I've been kind of like, now I have a good handle on it. I'm like, I think I have this. So I haven't had any diagnostic tests.
That's fine. I'm curious though, how familiar are you with functional medicine, and like, do you know any functional medicine doctors? Not so much.
I know a few people have mentioned it to me in passing, but I don't know much about it.
I'll give a quick shout out. I had a guest on recently, Pam Jacobson, who's a nurse practitioner in California. She's a functional medicine practitioner. So functional medicine just goes through a it's different than conventional medicine. It's a much more thorough look. You're working with that practitioner multiple hours to go through a bunch of blood work, a bunch of different hormone testing and things like that, where again, I think the reason I'm bringing it up is because I'd be very curious, and I might go back now as we're exploring this concept and maybe go speak with folks like Pam about maybe what they're finding with, because so she's able to detect an autoimmune thing that, again, it's looking for optimal ranges, not just, oh, you're within the normal range. And again, what's the normal range when you go to your normal PCP or whatever, a primary care physician, for those who don't know the lingo, and they're going to say, oh, you're within the normal range. But now we're talking about, I want to be in the optimal range. Vitamin D, for instance, the reference range, I'll say, is 30 to 100 for most folks. And if you're at 31, they might say, oh, like you're a little low. But it's like, you're nowhere near optimal is like 50 to 60. So, we need to get you up there as fast as possible to get your health booming. But yeah, bottom line is, I think they define things differently, where again, most other endocrinologists are going to be like, yeah, you're fine. And again, that's no disrespect to them. I don't want to talk trash about anyone. It's just a broken medical system that I think we can all agree is a thing. And everyone's doing their best, but some people are able to do it different ways. And again, that's stuff I certainly am always exploring. I do think functional medicine needs to come to the forefront in the near future. And so that's where I wanted to at least bring it up in there. And I don't want to dominate the conversation.
I've seen some people bring it up on social media with long COVID specifically. And a lot of this seems to be like, I mean, we all, start in like a traditional medicine route and then just not getting answers, being told that they're fine, knowing that they're not fine. Like, it's just, you can feel you're not yourself, and have gone that route. And it's, again, it's been like across the board. There's been a whole range of people's responses to things. And it's been neat to watch whatever someone's choices and whatever practitioners they're seeing, what they're trying, the responses. One of the long COVID physios, Darren Brown, who I call, like, he's like our leader. He was joking a while ago, like, he rattles because he always has so many supplements and things with him. Like, if someone says to try it, like, as long as it's safe, why not? Because there aren't any set answers right now.
Yeah, I got you. Yeah. So functional medicine definitely for me is something that I think that again, it's usually not super covered by insurance. Some of the blood work that they request might be, depending on your insurance plan, things like that. So something for me that I, again, like, think should really be pushed as much as possible, especially with frustrating things like this that the current conventional medical system doesn't necessarily have an answer to. That takes us to your third point, a little bit, nice segue, hopefully, of so strategies that physios can use to help patients when graded exercise is contraindicated, because again, that's something that happens here, right? They say like, yeah, you just don't go too hard, because like you're gonna make it worse, or you're gonna exacerbate your own thing. And again, everyone's learning as we go a little bit with this thing, but yeah, share with us your experience and maybe advice you have for folks, either as practitioners or as patients.
Yeah. So one of the big things early on is to find out in your history if the person has post-exertional malaise, post-exertion symptom exacerbation. We're just different terms, but basically it's the same thing. If they're crashing, if after any kind of exertion they're done, like I was already describing, because that's a big indicator that graded exercise, what we typically would do with people, is not going to be appropriate. And pushing them like one more set, come on, keep going, will make them worse. And we already know, patients want to please us and they're going to push more, and they might not recognize like this is bad. Like I currently am seeing, I have one patient with long COVID, and they had gone through, I tweeted about this, pulmonary rehab, because they were from the acute COVID and have some other pulmonary conditions already, and crashed after every session and didn't know what that was. And were telling me they missed a couple sessions because it was so bad, got back, and they're like, yeah, we got to go even harder. Like, that's not the response. You should see a typical response to exercise. And if they're crashing, if they're getting worse, then the graded exercise is not appropriate. For some people, it could be. If they don't have those crashes, then it could be like more of a traditional progression. So in that case, then we're looking at, or if they have dysautonomia too, that's really important. That we're not just pushing, standing up, very big dynamic exercise. Starting with breathing. That's a really big thing, getting some good supine diaphragmatic breathing, teaching them how to do that. Many people tend to be like hyperventilating and like a lot of accessory breathing. I was doing that and didn't even realize, and I'm a PT. So working on that.
I would say 98% of the people I assess, even virtually, that's the first thing I do. And I just tell them, take a deep breath if we're on camera here. And 98%. The only people who do it right are people who've either been told by someone like you or I that like, hey, let's do this and let's go through this and change that pattern. Or if they're like performers, like that know how to really engage their diaphragm. If they're not one of those two things, then everybody just breathes wrong, especially women. Got to stick your chest out and suck your belly buttons in, and that get. And again, I do need to go on this little rant real quick. Sorry, if you're Pilates and yoga love that cue of like suck your belly button to your spine, which I think it has its place. You want to be able to like vacuum and have the skill to do it, but then they get taught. And again, most people I see coming from that world who've been given that cue go to like, that's how I'm supposed to live. And again, then it reinforces worse breathing patterns. So anyway, I needed to
I'll add to that, because since I dance, is particularly in ballet, you hold your core. At no means anytime do you let go. Even when you're extending back, you're still holding it. Like that's a thing. And you're learning to like literally isometrically contract everything you possibly can as you're moving. So for me, like ballet has been helpful for movement, but I look at my Garmin during class and my stress score goes up and my heart rate's up, and it's like, oh, because I'm not breathing properly. Yeah. Everything's tight. I'm holding everything. So that's something I've been working on, is like changing my brain to be able to breathe better when I dance. Yeah, that's a big one. That's a really, really big one.
Yeah, that's huge. And yeah, I think for most people, it's always the first thing I go to, no matter what the diagnosis is, no matter why I'm working with that human. I'm like, let's take a look at your breathing, because if we can fix that, and you take 23,000 breaths a day, it's the thing that we do the most. And once we can make that switch, I find significant. Maybe it fixes 5% of things, but that's a pretty big percent. Like without having to do much else, just breathe a little better. If you're driving and you're freaked out in a car, and someone cuts you off, instead of like freaking out, just learn how to control your physiology. I actually have Physiology First on tomorrow on here, if you're familiar with that channel on Instagram, things like that.
That's exciting.
Yeah, so they talk about some of that concept. And then there was another, I'll give another shout out. Actually, I think it was Andrew Huberman, who's a very interesting dude to follow. And he basically was making the argument on another podcast I was listening to about that before we even get a driver's license, we should get like a breathing license. So like you should learn how, like, oh, if I can take a deep belly breath, it's going to change my physiology. And like, I go from being
Yeah.
angry and maybe wanting to go shoot somebody, to like, you know, calming down and being like, oh, okay, that guy cut me off, but nothing happened. And okay, you can go ahead of me in traffic. Like, just take a big breath. And, you know, and we're taught this stuff. And, you know, there's all the old idioms that our, you know, grandmothers or mothers used to say is like, sit up straight and, you know, just, take a deep breath before you make your next statement or move. And there's a lot of power and truth to that.
There is. Yeah, so I drive a lot for work. I drive a ridiculous amount every day. And so I have my Garmin. We have a whole thing we do with them at Proactivity. We were doing the PT health study. And so I try to use the data, and I would see when I was driving, my stress score, which is a Garmin thing looking at HRV, would go up, regardless of if I was in traffic or actually stressed. Like that would change. And I started working on my breathing while I'm driving. I worked with a respiratory physio from Canada, and she gave me a lot of really great cues. And I would practice like slow inhale, even slower exhale. I would do it to music since I dance, and that helps. I still have like weird stress scores, which I think is the cognitive demand, but that makes a difference. And to be able to kind of to bring things down a little bit.
Yeah.
That's super helpful.
Yeah, I love that. And yeah, I've done that on a few podcasts before. We don't have to do it right now, but like I'll pause and be like, let's do a 4-second inhale and an 8-second exhale. So if you're listening to this at home, you can feel free to do some of that. And again, it changes how you feel. And again, almost everyone I work with, I encourage them to do some like crocodile breathing, deep diaphragmatic breathing before they go to bed, because it just kind of changes that nervous system from that fight or flight to rest and digest. And again, there's another podcast we had on here. I miss New York City. Thank you for the sirens in the back.
You can hear that?
Yeah. Yes, I can. That's all right. Not as bad as one of my recent guests where he was in the hotel lobby in Florida, and that was loud and unpleasant, but that's okay. Distracting, I'll say. That's all right. James, I still love you if you're listening. And sorry, back to that. So breathing. Yeah, so it changes the whole thing. The other guest that I had on was Stephen Horney, who I'm having on for the third time, I think, in a week or two. And he pointed out that I think the diaphragmatic breathing, when you actually do it properly, it's actually massaging your vagus nerve. So there's some really powerful stuff there that it's, again, in terms of just the physiology and understanding the importance of that. The other bit I'll connect to that for kind of my own self promo, I guess, is I did a video recently about when you're wearing a mask, and luckily we're kind of coming out of wearing masks, hopefully, but still, if you are wearing a mask, utilizing that time to just do nasal breathing. And so if you do nasal breathing, have you practiced just nasal breathing, by the way?
Yes, often.
Yeah.
Yes.
Awesome. Yeah.
That helps.
So, and it's powerful stuff again there, because that's the only way for the body, that my understanding physiologically, to release nitrous oxide. And again, it almost taps into deeper connections physiologically of that vagus nerve and just, again, switching that sympathetic nervous system over to that rest and digest. So the nitrous oxide, which is what is laughing gas, so that dentists give you, for those at home, I'm sure you know that, but it's powerful stuff. It's a relaxing thing. But yeah, you can only do it through your nose. And again, the nasal breathing. So again, if anyone's not familiar, I would challenge you to do 5-minute, even walking, and just do nasal breathing. If you have the mask on, it's a good reinforcer for me to just do the nasal breathing. But yeah, if you want to go as far as doing some cardio, and you want to get on elliptical or bike and just do 5 minutes of only nasal breathing, see how that feels. And it's going to really, really challenge you. And again, I'm sure you can attest to that as a way to improve overall lung function, for sure. Yeah,
that's been, for me, the diaphragmatic breathing has been a game changer. Or I have back up, like I had costochondritis really bad, like a hard, like I couldn't pick up light dumbbells. It was so painful. But that was tying into like doing so much like chest breathing, and like I was focusing on like supine and feeling everything kind of like compress again. It made such a huge difference. And for me, that ties into also not just lung function, but the dysautonomia. That was a really big thing, and tapping into the parasympathetic nervous system and trying to retrain. Where I worked on a lot in the beginning with this super slow full exhale, where it was uncomfortable, not painful, but very uncomfortable, because I hadn't been doing that in months and months. And now I can fully exhale and it's fine. And that's been really helpful.
For anyone listening at home, you mentioned costochondritis. Now, just to break that down, that's basically an inflammation in between the ribs, right? Up in there, sometimes along the sternum. And so did that come from the breathing, from the long COVID?
Yeah, that's the theory with it. I had it once, like in college. That was nothing. It was for like a week. So outside of that, like I've been
I'm
fine.
I'm sure
Yeah.
the dancing probably I would hypothesize predisposed you a bit to that with the way again that breathing is taught
Yeah.
and things like that.
With yeah, with certain styles of dance. I
Yeah.
predominantly tap dance, and
Mm,
we're relaxed. It's fine.
okay. That's
Ballet is
good.
the like
Yeah,
difficult
ballet.
one.
I thought you mentioned that. Sorry that
Yeah,
but yeah,
yeah,
I would
yeah,
think that would yeah.
yeah. Ballet is what I was. I Yeah, I had the costochondritis before I got back to ballet. I was trying to remember that.
I gotcha.
Yeah. But yeah, so the thought was that I was just very like here all the time. And anything I would try to do that, like if I for some reason had to do something this way was searing pain because I didn't have that mobility anymore.
Yeah.
Everything was here. So it was a lot of work to try to calm things down, but it made a huge, huge difference. The
Mm,
breathing's been big, especially going back then with patients breathing. And there's so many, we go forever, so many benefits too. We're just working on breathing.
yeah.
And today the patient I was working with was asking like, what's my goal? Should I try to do this for 10 minutes a day? And I'm saying, no, it's hard to not want to set goals like that. If I did 5 minutes today, I'm gonna do 5.5 tomorrow because our symptoms fluctuate so much. And you have to teach yourself to not feel like you're digressing, that you're doing worse because you did less than the day before. It's kind of going with how you feel that day. And if symptoms are flaring up for whatever reason, all right, then maybe we don't do all the breathing, which can be really taxing. You might think of it as
Mhm.
not much, but it can be, especially long COVID, can be really taxing. And finding other like strategies to help them cope with their symptoms, as opposed to, again, like, here's what you did today. We're going to do a little bit tomorrow and a little bit more the next day.
Yeah.
That gets very frustrating. It teaches you then to like push through symptoms, which you shouldn't be doing.
Yeah, for sure, for sure. That's one of the other reasons we were talking a little before the call of you're more in a traditional PT setting,
Mhm.
right? Insurance based, so you might see the
Mhm.
people twice a week or once a week
Yeah.
versus at some point I realized that I'm like I feel like there's a better way, and the way I work with folks now is I connect with them every single day. So
Oh,
of course I charge more. I don't go through insurance,
yeah.
but I feel like for those that can uh, go through that system, it just we're more likely to be like again like let me know if you're really sore from what we did on
Mhm.
Monday, and then we can back off on Tuesday. Otherwise, we're going to go ahead with the plan.
Yeah.
But if I'm not there to have that conversation, like again, most people aren't texting their physical therapist like, "Hey, I'm really sore," or "I expect," or you just don't know. You don't have that communication. So that's another problem I saw with the current medical system, and I said let's figure out how we can fix it, and there are solutions out there, hopefully,
Yeah.
maybe, hopefully. I did want to come
That's
back. Yeah, go ahead.
I say that's something actually like I will text with my patients because I want to make sure they like
Nice.
feel free to ask questions and things, regardless of why I'm seeing them. It could be the most
Right.
straightforward, simple orthopedic thing. But to have that line of communication, yeah, because if you only see them once or twice a week, then they're waiting like 5 days to like ask you
Yeah.
something. It could be like such a simple thing, like, oh, here, try this instead, or let's
Yeah.
do this, rather than
And
having to wait.
yeah, and I want to challenge. And I think the only way we're gonna make big change down the rabbit hole is, or down the chain or whatever is by getting patients, the consumer especially, to vote with their dollar, so to speak. And
Yeah.
so if you're in a situation where I understand the desire to go through insurance, because that's always the first thing I get asked is like, do you take insurance? And I say no, and here's why. And so I do want to challenge patients, especially if they're listening, or pass along this kind of concept. Two things I tell a lot of patients is, one, challenge, like, you should be getting VIP treatment. So if somebody's willing to text you, like that should be the
Mhm.
bare minimum. Whether
Yeah.
you're emailing them or able to text with your PT, and again, there's some continuity of care there, and there's somebody who actually cares about what's happening to you. And then the other one too, I always say is if they don't have a squat rack or a barbell in their clinic, then you shouldn't go there. So it's a whole nother
Yeah.
conversation that we could certainly go down the path of. But I am curious. We talked about trying a bunch of different things, functional medicine. Are there any supplements, nutritional changes that you've looked at, talked about, again, and especially because you're in those circles in PT Twitter, that's been brought up of possibly, again, helping improve? Because again, going through what I went through, and just being like, I want to get back to getting my lung capacity
Okay.
100%, and I like being active, and I feel like I'm pretty close to that. So is there anything you've explored or looked at in that sense?
Yeah, there hasn't been any obviously one set thing that like works for everybody. But so this ties into also me. So I work at Proactivity, very, very health focused, which is beautiful. And well, big thing is looking at your overall like inflammatory load and all the different things that can contribute to increased inflammation, which people with long COVID are experiencing. So trying to cut back, just like typical, like processed sugar, processed foods, getting more plant-based to try to calm down that inflammation. Not, like I honestly couldn't even remember a specific thing right now because there's so many. I feel like every person I've talked to is trying something different, whether it's their own personal thing or they're working with whatever, healthcare provider, whether it's traditional medicine or not traditional medicine. But the general consensus on diet seems to be trying to decrease that inflammatory load, really avoiding processed sugars, dairy. I'm for the most part vegan, so this is my dog Roxy. Trying to cut down on animal products, trying to cut down meat, chicken, fish, all that kind of stuff, and look more at like a plant-based diet. But again, not a general thing. Not everybody's doing that. Not everybody's, as you know, open to doing that.
Yeah.
But the way I kind of look at that is like, couldn't hurt. Look, it's not going to hurt. I already kind of eat that way anyway.
Your dog is in there. I'll show my dog sleeping back here.
Oh.
Yeah. Little doggy love. Sorry if you guys are on audio, you don't get to see the fun dog. Oh, you get to hear it, since that's okay. Yeah. There you go. Yeah, no, dairy is one. Yeah, go ahead.
Yeah. Well, that too. It's interesting for me on like the patient side because I can, as a PT and AT, explain all these recommendations, and then on the other end, like I don't have the energy to go food shopping. Like I go to what I explain is like, you'll get this. A suburban bodega is around the corner for me.
Yeah.
So not always the best options for things, but there's some like produce I can get. But then when you're looking at, well, if you can cook, then like I can't cook because the energy it takes to prepare a meal, to think about it, cook, clean the dishes, like meal prepping, even like, yeah, that's too much. When I have to like weigh out where do I need to put my energy, like that's why I look at it. What are the things I have to do? What are the things that are like I really want to do? Maybe I don't need to do it. It's okay. Or the stuff that like, yeah, this is just like kind of extra stuff. So that makes it really challenging. Then this is probably in some respects like some of the worst I've eaten in a while, just from like not having the energy to eat better / not having an amazing grocery store within like a short distance from my house. Right. So that's a really important thing to consider with patients too, is we can make all these amazing recommendations, but with long COVID and other post-viral illnesses too, when energy is really minimal, how do we help them do what they need to do, but at the same time, not taxing their limited energy system?
Yeah. That's interesting. I mean, I'm a problem solver by nature, and something that first thing that came to my mind is, again, obviously, yeah, if you have the resources in that kind of situation, almost get like a personal shopper or TaskRabbit kind of thing, and like you have them go to like Costco for you or something. I don't know if that's something that's even possible, or yeah, I mean, I guess there's ordering groceries and things like that too, but yeah, you still have to cook it and all that stuff. So anyway, I go to that quickly, but I want to come back to your Garmin you mentioned. I use the Whoop, which I wanted to shout out real quick. So what kind of you mentioned, obviously there's tracking your heart rate and HRV, which is interesting that they were able to track that like through my understanding of HRV, and I've looked at it for a long time, is it's really only accurate for kind of recovery and like first thing in the morning. So you mentioned that it's tracking it kind of during when you mentioned that it's like looking at your stress while you're in traffic and things like that. Is it looking at, you're talking about like the next morning where you had like a stressful day, or is it actually tracking it in the traffic?
Yeah, in real time. Like, and I'll pull, this is something, I didn't do this in the beginning. It was also really cognitively demanding in the beginning, honestly, but now I've been trying to look at stuff more. Yeah. So I will pull up the app in real time when I can and just try to look at trends. Yeah. There are points where, so I'll give a real example. When I drive, sometimes it could be far and you'll see it's not high, but my heart rate will start trending up. It's not high by any means. Like it's going from like low 60 to mid 70s, like crazy, but it's trending up as I'm driving, not even traffic, just like normal driving. And then you'll see a general trend so it's like an hour and a half drive. You'll see a general trend over the next like 2.5 hours that is gradually is coming back down again. Like, that's not great. And the same with the stress score. You'll see my stress score like shoot up when I'm driving, and then it'll gradually like come back down again. So I try to correlate that. I can't obviously always help when that happens, but I try to look at when that is going on. And there are any things that I can do to try to work with it. Like I would be eating in my car because I'm driving a lot and that's what I have time. So like, well, maybe if I don't eat, because that is like a stress to digest food, but that didn't make a difference. Or maybe if I don't drink coffee, maybe that'll change it, but that didn't make a difference. But there are some things where I found where like, if I had a particularly just general normal stressful day that I'm just tired, whatever is busy in the clinic, as soon as I get home, I will lie supine And I literally can like watch my heart rate come back down, watch the stress score start to change, especially if I'm working on the diaphragmatic breathing. So I've been trying to find ways to use this in real time. And then with proactivity, with our program now with the Garmins, we have a whole dashboard, and it's really neat to look at more data that's available to see. So that looks at like a bigger picture. You can look at trends over time, like meaning days or weeks, versus using the app when I'm looking at that in real time, because I'll use that to like make a decision. Like, should I try to go jog a mile? Let's see how I look that day. And not that it's a definite science, but it has made a difference. If I see a higher stress day, then I'll rest more. If I see my heart rate's up for whatever reason, I'll rest more. Even if I don't feel off, I'm hopefully preventing crashes. That's a big thing, preventing crashes, because they worsen symptoms. They possibly can be prolonging recovery. We don't definitely know, but possibly. So trying to prevent crashes is a big one. So I use the data as much as I can.
Yeah, so it's super interesting. Yeah, the Whoop gives us so it's tracking it. It gives us the recovery score in the morning. So I don't know if the Garmin's similar, but yeah. So like, yeah. So that's where the HRV reading. And for those not familiar, I'll say real quick: HRV, heart rate variability. So instead of just looking at like my resting heart rate, which I've also been tracking and monitoring as a data point, for me before COVID, I was in like the mid to high 40s for my resting heart rate in the morning when I'm super calm and rested, but since COVID, like during COVID, during my not so great time, I was in the 70s for resting heart rate, which is not very healthy. Again, it's still like a resting heart rate between 60 and 100. We were talking about the medical model before. That's still technically normal. And again, but yeah, it's I want to be down as low as I can be. So for me to go from 48 to 70, in the 70s was definitely not great. I'm back into like 54, 53, and I'm tracking that every day. But the heart rate variability is not just looking at how many times it beats per minute, but it's actually showing you your kind of readiness and how physiologically ready you are for exercise theoretically. So it's actually looking between each beat. So the first beat, and I might be totally off on this, but it might be like 0.9 seconds, and the next one might be 0.7, then 1.1, then and we're just looking to see how far apart. And the more variability, you wouldn't think that instinctively, our brains don't think that way, but the more variability, actually, the higher that score is, that's actually better, because now you're more prepared for a crazier day in traffic or to go do some kind of, again, intense workout, that kind of thing. So yeah, super interesting. And yeah, a lot of times, and my wife uses it as well. A lot of times I would say she has an autoimmune condition that she got diagnosed with the functional medicine doctor that, again, would not show up in traditional medicine. But we're trying to mitigate that through because it hasn't affected her thyroid yet, which is kind of the bare minimum for traditional medicine. But those signs are there. So now, again, we're getting into deeper lab reading and things like that. So anyway, super interesting about, like checking that score and having a device tell us like, hey, you might even feel great. And what I was going to say about my wife especially is she tends to be like, oh, my score says it's really bad, but I feel really good. Or the opposite of my score says I'm really good and I feel like shit. So, that happens a lot there.
I look at too, Garmin has, you remember this, it's also the body battery, which is like 0 to 100. And that's looking at recovery. So you ideally want your battery to go up to 100 when you're sleeping. Which part of this I learned because it typically doesn't, and in part is looking at your estimated VO2 max. So mine, I'm assuming, is getting worse because I haven't been running for like almost a year and a half. So that makes it a little trickier for it to go back up. But that's the thing I'll look at too, is am I achieving that overnight? Typically not. And then just kind of using that as like a rough gauge also to how much I can actually push the next day.
Very interesting. Yeah. Coming back to a previous flow, because I go off on tangents, and this is why I took a note here, and I did want to come back to this. So we talked about supplements, and a previous guest I had on, Jeff Evans, started a specific supplement company that has a product called Flow, which he sent me a nice sample of, a month sample after he was on here, and luckily I got COVID and now I can try. But it basically is meant to be an opening up oxygen pathways, and it's an all herbal kind of supplement. Now, I've been exercising more regularly, and I don't know how much of this is like just the regular effect, but I definitely have been improving since taking it. And I tried to actually hold off on taking it until I felt like I was getting, got a little more flow and consistency. Ironically, the product is called Flow. But yeah, anyway, it's something I'm gonna look into, and as I come off of it and I finish my month supply, I'm gonna definitely see how I feel without it, and then see if I can reintroduce it. So at some point, and I would definitely I have to shout him out again as a friend and also former guest. And then if that's something you're interested in trying, we can definitely probably connect you after the call and all that. So I'd be curious, if stuff like that would be any kind of help for, because again, at the end of the day, we're trying to open up pathways. So other stuff like beta alanine, again, at the high end of physical performance, I want, it's supposed to improve like, 1 or 2%. And maybe you're going from running whatever 12.2 seconds to 12.1, or 12.0 seconds, that kind of thing. But again, when you're dealing with stuff like this, I imagine every little bit that we're going to do, my thing on social media is get 1% better every day.
Yeah.
So if we can do little things to improve little by little, I mean, that definitely, and then there's no harm in most of these kind of supplements that I talk about, at least. And there's very, very few ever side effects. The only side effect I ever heard of beta alanine, my friend who plays the Phantom of the Opera on Broadway, it made him very stinky. It made his sweat very smelly. So, and his partner at the time was like, you cannot take that anymore. So he just had
that's
to give
not appreciated in a dressing room.
Yeah, that too. Yeah, exactly. I appreciate it. I think we covered a lot of fun stuff, and I want to be respectful of your time. It sounds like you had a really long day.
I always have long days.
But I think we covered a lot, and again, hopefully, I'm excited. I checked out that other episode of the long COVID physio podcast, and I recommend folks do that, especially if they know anybody dealing with this, and hopefully, we start to get a lot more data, information, science coming out, and again, that stuff is all going to change, probably, like you said, daily, and hopefully, we get some good stuff coming out soon.
I'm going to plug long COVID physio a little bit, because this is really great to know. Like I said, so we have our peer support group. If anybody is a PT, PTA with it, we're long COVID physio on Facebook. You can join. Outside of that, on our website, which is longcovid.physio, we have, so like I said, the podcast. You can find all the episodes on there. There's audio versions. You could go on YouTube and watch them. I did one of the first episodes is talking specifically about how it's affected me as a runner and a dancer, because it's a big part of my identity. So we have PTs with it, talking about their experiences, and like I said, the one with Jenna, we have experts on talking about whatever their field is within long COVID, how lending in their expertise. We have a blog where some of us have written about our experiences, so that is available. So patients have found this really helpful to hear from other people, because you start to think you sound crazy, because it really does. There's so many. I'll give an example. With our employer clients, I was talking to someone. He had been hospitalized and still has a crazy mix of symptoms. And then we had talked about being sweaty, because I'll tweet about #team_sweaty, because with the dysautonomia that happens. And he was just like, you get sweaty too. I'm like, I get sweaty too. Stuff like that. But it helps though, when you hear that and you're like, you're going through this, you have all these really weird multi-systemic things going on. So patients really appreciate like the podcast and the blog when they can hear about our experiences. And then there's also a resources page that goes topic by topic. So like post-exertional malaise or exercise and breathing pattern dysfunctions. There's a ton of them that are up. And one more really great thing that's on our website that's available elsewhere. In the UK, they have AHP, the Allied Health Professions, and Rachel Moses has been amazing. She runs their YouTube, and she has posted tons of amazing episodes with all kinds of clinicians, researchers, patients. I was on one talking about long COVID. So there's a bunch of them. It's AHP Leader, but you can find the link on our website. And then she did a day of learning all about long COVID. I want to say 8, I could be wrong, different sessions going from research and PT and all kinds of stuff. It's really great. So you can learn like the broad range of what's going on, hearing what the speech language pathologists are doing, what the OTs are doing. So there's a lot of information that's up on our website. And I think Daria Brown is our leader with this, and he and a couple other people in our group contributed to the briefing paper from World Physiotherapy that just came out on long COVID rehabilitation. So really, really important, great paper to read. Nothing that you're not going to be super overwhelmed, not a super, super long document, but it's really great. If somebody needs like what do I need to know as a PT on long COVID? Thank you. Yeah, that is up. You can find it on our website. World Physio has been posting it everywhere too. Yes, great, great website.
Awesome. Yeah, no, it's just again, hopefully we start getting some better answers soon with all this stuff. But yeah, just really cool to see this community come together and just trying to find answers together and probably a bunch of great minds hopefully coming together to come up with some good solutions. So really appreciate it. Any other places we can find you, Pete, on Twitter?
Twitter, I'm on tap Physio 2.
Yes.
My
Your
on tap
first
Physio
one got suspended
for posting videos of copyrighted music, and they're not helping me get it back. So on tap Physio 2, which is really frustrating because I can't go back to all my old tweets about long COVID. It's as of March that I have like this new one. But yeah, I'm on Twitter often, whether it's connecting with other clinicians, researchers, patients with long COVID. I talk about other stuff too, but long COVID is obviously the really big one. And Twitter, not just PT Twitter, but in general, has been really, really helpful. That's how long COVID started, that a bunch of us patients found each other on social media. And there are groups like Body Politic and Patient Led who are literally leading the research. They are like PI on the papers. They're the ones saying, we need to study this. And what I experienced in the beginning was, I couldn't find information, but I said, well, people are dying. So in terms of priority, it's not me, it's the people who are dying. Right. But they're saying, no, but we still have problems. We need to do something. And if traditional healthcare systems aren't able to help us, well, we're going to do it ourselves. So all the patients have been coming together, whether they work in healthcare research or not. And it's been really beautiful to see. Like, it's sad it's happening, but at the same time, it's really neat to see using social media for good and how to connect with people. And that's how I find all the research. I could never keep up with this trying to go through PubMed. So I know which accounts to follow, that they're going to be posting like the big articles coming out. If there's a webinar or a conference and I can't attend it, somebody's going to be live tweeting it. And I could just, kind of follow the thread and get the key points on it. They link everything that's available. It's wonderful.
Awesome.
Twitter's been amazing.
Very cool. Awesome. Well, yeah, I think that's an awesome spot to leave off on. Plenty of places to find you. And guys, if you liked this podcast and you made it all the way through, don't forget to like, share, subscribe, and comment, and leave a rating and review. That's always good and helpful. Yeah, appreciate you listening. And Daria, not Holler.
That's a great one to remember.
Oller.
Yep.
Oller, yes, Oller. Okay, so it is probably no. I actually had a client from Australia that I'd been working with a bunch, and he was on here, and his name is Mali. How would you pronounce that?
Molly.
That's the right way to do it. Good for you. I was saying Mali, like Mali, like Mali. Anyway, but that was the wrong way. But I had him on here, and and even though I'd been communicating with him mostly virtually, it was the first time I had to like introduce his name, and I was like, oh, I've been saying it wrong for like 2 years. Cool. Anyway, so we'll leave it on that. And do I have a 90s theme song that we can get copyrighted for and have our account suspended for? No, maybe not really. I don't know. Yeah, let's finish off with La Bouche. We'll finish off there. Don't copyright me, YouTube. All right, guys, we'll see you next time.
Thank you.